There are alternatives to tummy tuck, but as with everything in plastic surgery, it comes down to making an accurate diagnosis. Now, somebody who comes into me who has a tremendous amount of stretched out loose skin and a big gap between the muscles of their abdomen, they need a tummy tuck. And if you don't give them a tummy tuck, you're going to give them a mediocre result. On the other hand, someone who's, say, 20 years old, tight skin, and just has a little extra fat in the tummy or in the waist, that's a great candidate for liposuction. By almost any technique, you're going to get a good result. The problem in the past used to be people in kind of that middle ground area, where they didn't have a tremendous amount of loose skin, but maybe they'd had a couple of kids, or maybe they'd gone up and down in weight, and the skin was definitely looser than they'd like, and the fat compartments of the abdomen had a little too much fat. Now, if you try to do liposuction in somebody like that just by conventional technique, the problem is going to be you're actually going to leave the skin looser, and it's not necessarily the best trade. So along comes BodyTite. BodyTite is a device that I combine with liposuction, and just like liposuction, we make tiny holes, we put fluid in, we extract the fat, but then we put in a pair of probes that are joined together. One sits on top of the skin, one's under the skin, gliding back and forth, and energy flows between the tips. That causes a tightening of the skin, about a 30% tightening. And that's what makes all the difference, because now there's people in that middle ground who can avoid the complexity and the big recovery that you get with a tummy tuck. The other great thing about this treatment is that it can be done under a local anesthetic technique. Almost all these BodyTite procedures that we do are pure local anesthesia, and patients absolutely love that. So in the right patient, there can be a good alternative to the tummy tuck.